Welcome to GBMC's Greater Living. I'm Mary Beth Marsden. Thanks so much for joining us, and I hope everyone is doing well in the age of COVID-19. Of course, we're going to be talking about the coronavirus and how the pandemic continues to affect us, but specifically today, for the next hour or so, we're going to be really focusing on how corona and also just day-to-day life now in this age is affecting our emotions, our mental state, our minds, and our brains. So we're going to talk right now first with an expert in the brain and all issues of neurology, and that is Oluwatosin Thompson. Dr. Thompson is a neurologist at GBMC Health Partners Department of Neurology and looking very dapper today. Thank you so much for being with us.
Good to be here.
So let's just start right off the bat. I think everyone is talking and thinking, even if they're not waking up in the morning and that's not their first thought anymore, certainly throughout the day, we're all thinking about COVID-19, if we have our face mask with us, how we're handling it, checking in on our mental state from day to day. And I just want to know, just in the broad sense, how your job has been affected, how it's changed over the course of the last 3 months, and where you are today with it.
Yeah, I think for my end, the challenge has been providing the patients the care that they require, they deserve, while still respecting the new restrictions that we have on our ability and capacity to provide health care. So it's sort of been juggling that and much more video visits now and telehealth visits, which does limit my ability to examine these patients and really limits my ability to truly understand some of the concerns that they have. But we're sort of doing the best we can with what we have. Thankfully, with some of the restrictions loosening, we're able to bring in some of the more urgent cases into clinic so they can be seen by me and examined and even sort of get a more in-depth evaluation that way. So I think that's something every physician is having to grapple with is in this new world, is how to do their job the best way possible with the restrictions in place.
I know that you guys are doing the best that you can in a difficult situation. I get the sense from everyone that there's a certain feeling of getting used to the new normal and not being as fearful of the what ifs, because we've kind of passed that critical point, at least for now, right?
Yeah, I think certainly I see more people more willing to come out to clinic to see me now because sort of they feel a little bit more, how should we say this, more used to this new normal. And they know that, taking those necessary precautions at least will limit their chances of coming down with anything. So in a sense, that helps because I can sort of get to their concern and, they don't have to have this fear that, they may catch COVID-19 by just coming into clinic, which helps us get to their concern, that in that moment.
Yeah, Dr. Thompson, I want to touch on what you mentioned just a moment ago, and that is about the telehealth and some of the challenges that you're finding. This is, in some ways, a learn as we go, and for the patients as well. So can you speak specifically to some of the issues that you're finding in trying to consult a patient over whatever you're using as far as the telehealth goes?
Yeah, and I think really it's specialty specific. As a neurologist, a huge part of my job is examining the patient. So, for example, someone comes in with tingling in their feet. It's very important for me to examine the patient to, number one, get a sense of how severe it is and where exactly it is, and things like that, which is really tough to get a feel for via phone or via telehealth. So that's been a challenge that I've had with all of this, but we do the best we can. And if I feel, based on the conversation I'm having with them, that this might be something more serious underlying their concern, then we can always work to bring them in while still keeping them safe best we can.
I had heard stories early on in the pandemic that people who may or may not have been having symptoms, but were not paying attention to the symptoms, not getting them treated, not being seen because they were fearful of coming to the hospital or coming to the ER. Are you finding that people are becoming more willing to put themselves out there in the world because they need some medical attention?
Yeah, I think as they're getting used to this new normal, they're beginning to realize that, okay, this is the world, that we're living in, and it's probably not going to change for the next, couple of months or even longer. So I'm glad that people are once again beginning to focus on their own personal health and these issues that, unfortunately, even with COVID-19, it isn't getting any better for them. So they're beginning to come in more to my clinic or even to the ER to get cared for, which is good, rather than even, something more serious occurred to them. So it's better to come in off your own volition than to be brought in, say, by ambulance or something like that.
And we're going to talk about symptoms to look for in just a moment. But first, I just want to kind of define and let people know who are watching what you do exactly at GBMC. I know you play different roles.
Yes, I'm a general neurologist here at GBMC. I'm mainly based in clinic. I see a wide variety of neurologic conditions in my clinic. Every couple of weeks, I do go into the inpatient ward in the hospital where I see more urgent neurologic, cases. Many of these cases we'll be talking about today.
And when you say neurologic cases, what are we speaking of? Are we speaking of a stroke patient? Are we speaking of someone with dementia? What kinds of issues do your patients have?
Yeah, you're spot on, Mary Beth. I think number one thing is stroke or a mini stroke, also known as a transient ischemic attack, a TIA. That's probably one of the most common things that brings people into the ER or, eventually has them admitted to the hospital. So stroke-like symptoms. Other things I see, symptoms concerning for seizure, worst headache of one's life. Those are all reasons that people come into the ER. Other things too, of course, confusion, sudden onset confusion, or even severe neck or back pain with neurologic symptoms accompanying it. These are some of the most common reasons that I see patients in the ER or in the hospital.
And at what point does someone decide who has a severe headache, who's thinking, oh, I don't want to go to the ER, they're dealing with COVID right now, I think I can handle it at home? At what point does someone decide to call 911 or get someone to take them to the hospital?
Yeah, good question. I think for someone who typically doesn't have a headache, if you have a really, really severe headache, that's a good reason to come into the ER. Or for someone who maybe has a history of headaches, if you have your headache but with new symptoms that indicate neurologic dysfunction, such as a headache with weakness or sensory changes or vision loss, those are all good reasons, or dizziness, those are all good reasons to come in. So I would say new headache or an old headache with new accompanying symptoms. I think these are reasons to come in to get checked out. Should
you call someone first or just come in? Because we tend to get sometimes mixed messages about when to take advantage of the expertise at the ER. And so I'm just wondering if it's a new headache, do we live with it for a while? Or is it just, if it's something so new and different to us, at what point do we make that call? And I know it's so individual, it's hard to say, but
yeah,
guidelines are always
very individual,
helpful.
But right, I would say generally if you have a really severe headache, way out of the ordinary for you, if it's, quote unquote, the worst headache of your life, that is a reason to come into the ER. Or if you have, a headache, but you have new serious neurologic symptoms accompanying it, such as vision loss or weakness or sensory loss in a part of your body, those are all good reasons to come in. And really, all of this is just to make sure, to catch more serious neurologic conditions that can sometimes present with a headache, such as, brain bleed or a stroke. So those are the things we try to catch, and that's why we recommend. As you said, Mary Beth, it's reasonable if you have a milder to moderate new headache. I think it's reasonable to maybe reach out to your primary care doctor first, or if you have minor neurologic concerns. But if it's serious, severe, or you have new severe neurologic deficits with your headache, those are all good reasons to come into the ER.
One thing I find especially comforting, and I'm sure it also helps you in your work, is that the staff is so well trained at the ER to recognize symptoms of stroke.
Right. Certainly very helpful. And, once you get to the ER, you will get excellent care. I think, of course, what often changes outcomes is how quickly the one who is experiencing these symptoms, decides to come in. And so that's why, it's always been part of my crusade to educate people about, stroke-like symptoms and when they should be, looking to come in, which often helps cut down time. Because like I always say, time is brain. The sooner that we can catch these symptoms and have you come into, to these care settings, the better the outcomes can be in these cases.
Do you believe in popping an aspirin at the first sign of any of these issues to maybe prevent something?
I would say no. Because often off the bat, it's difficult to differentiate between a stroke that's due to bleeding and a stroke that's due to a blood clot. So, if it's a bleeding stroke, you definitely don't want to take an aspirin. You can just make things worse. So I often tell my patients, if you're concerned at all about stroke, come in. Don't take an extra aspirin. Don't try and sleep it off. Just come right in and get evaluated.
Are your patients of all ages, or are you mostly seeing people on the older side?
I think it's a good spread. I see, I'm an adult neurologist, so of course I don't see anyone under 18 years old. But I would say beyond that, it's a fairly good spread, of patients that I see age-wise.
And from a neurologic point of view, obviously people very concerned about their loved ones who may have dementia or Alzheimer's right now, particularly right now, because if they're not living at home, they may be isolated wherever they're living because of COVID-19, which can exacerbate some of their symptoms. Are you seeing this as an issue because of the pandemic, increased confusion, just a worsening of behavior because the brain is having to adapt to all these new routines?
Yes, I would say so. In fact, I've had a few calls over the past few weeks of family members just saying their loved ones are getting worse. I think it's even more difficult for my patients with dementia who are in these long-term care facilities. So in these facilities, essentially being a lockdown, the loved ones can't come in to see them anymore. So that's been difficult. I think not having, being able to see your loved ones. And, of course, for those who maybe are living at home, they're being encouraged to stay indoors, at least in the past couple of months when, COVID-19 broke, they're encouraged to not really go out all that much, which, what we in the neurologic community know is that, in these kinds of cases, exposure to your loved ones in social interactions and exercise does help in reducing the cognitive impairment that we see with dementia. So unfortunately, with COVID-19, we've had a reduction in social interaction and, of course, in exercise, which has been detrimental to, patients with dementia and, of course, to their family, to sort of having to, think about their loved ones and worry about them and not being able to see them as often has been difficult too.
Yeah, and I would think too that for the patients you have who might be elderly or older, who might not be as technically savvy, the telehealth also makes it even more difficult.
Right, exactly. Imagine already having issues with your cognition, and now you're being told to sort of, figure your way out around, an iPad or, your device and figuring out how to FaceTime and things like that. It can be quite challenging. And of course, for those who, that's even a possibility for those who actually have the resources to have those sorts of things available to them. So it's certainly been a challenging time in many regards.
Everyone in almost every field is trying to figure out what the future holds post-pandemic, what will change permanently, what will never go back to being what it was. In the medical field, I'm sure that you and your colleagues are trying to figure out what are we going to do now from now on? Will this forever change how we see our patients and treat our patients? And what needs to change from your end to accommodate these changes?
I think what I see is actually a positive. I see increased access to neurologic care. we have so many underserved areas in the U.S., and a big reason for that has been just, a lack of neurologists in the area. Sometimes the closest neurologist is an hour away, and, driving your loved one there to be seen and figuring out accommodations has been tough. So I think with the sort of this new sort of advent of telehealth, I think we'll see more access to people, to a neurologist, which I think is a good thing overall.
Why is there a lack of neurologists? Do we have too few neurologists?
I think generally that's part of it. I think there's just not enough neurologists ever, and they seem to sort of concentrate in more metropolitan areas. So when you sort of drive out into more rural areas, you can really be tough to find a neurologist out in those sorts of settings.
I think neurology, at least from a layperson's point of view, seems like a really difficult expertise, because the brain, there's so much we know about the brain, but there's so much we don't know about the brain, which also makes it incredibly fascinating.
Yes, it's certainly, that's one reason why I came into this field. The brain is infinitely fascinating, and, we're learning more and more about it, year in and year out. So that's been good. And of course, it's exciting for me to be able to provide more and more resources and more help and more answers to my patients, as we sort of unravel this mystery of the brain slowly. So yeah, it's an exciting field to be in. I think even more so because with the intense research being done in fields that have given us problems like dementia, I really do see that in the next 10, 20 years, much more being available for these conditions that we unfortunately don't really have much in the way of therapy for at this time. So I think it's an exciting time to be a neurologist. It's an exciting time to be living in a time when access to neurology can be expanded via telehealth. I think overall that's good news for our patients.
That's very optimistic thinking for families who are dealing with loved ones who have dementia, because that's such a difficult and painful process for them. I get the sense, just in listening to what you've been saying, that you also put a lot of stock into, and we say this about everything, but about the brain too, living a healthy lifestyle.
Yeah, it's very important. I always tell my patients self-care is really huge part, in optimizing one's health overall, not only brain health, but just everything else. So, healthy diet, some amount of moderate activity or exercise, adequate sleep. I feel like these things, if they can be adhered to, reducing stress reduction, yoga, whatever it might be, meditation, to help reducing stress, all those things do go a long way in improving brain health and, of course, physical health too.
Dr. Thompson, when you ever get on your soapbox and you have like one thing you want people to know, what is it that you repeat over and over again to people, maybe before they have symptoms or when they get symptoms, but something you just want to hammer home?
I think the key thing here is that if you ever have, any symptoms that is, concerning, you're not quite sure, at the very least, to discuss with your primary care physician, open that, door of conversation. I think too often patients keep things to themselves, or they may have symptoms that pass and then they decide to just not bother with it anymore. But I would say if you have neurologic symptoms, if they're severe, come into the ER. If they're sort of mild to moderate, at least bring it up to your primary care doctor. You may sort of unravel something and reduce the risk of future harm. So that's something I would at least like to impress on all our listeners.
And one thing I just want to know too is one of your greatest tools the MRI?
I would say the greatest tool that we have is actually the exam. That's one reason why the telehealth has been a little challenging. But certainly the MRI is a good adjunct to our exams. Often it may confirm things that we sort of suspected on the exam, or for cases where the exam might be confusing or hard to obtain. Let's say in a comatose patient, then the MRI becomes key. But really the number one tool in our arsenal, probably with all physicians, is really the interview and, of course, the examination.
All right, so telehealth will help maybe a lot of people who might be living remotely, but there's nothing like seeing a patient in person.
Exactly, exactly.
Dr. Thompson, thank you so much for being with us. Be well and continue doing what you're doing. We really appreciate it.
Thanks, Mary Beth.